Hello, this is Karen Sanders, founder and president of RN Patient Advocacy of North Carolina and founder and president of the Holistic RN Patient Advocacy Training Institute. I'm here to talk to you today about moral injury, nursing practice, and relevance to unionizing. So moral injury is a deep soul wound that pierces a person's identity, a sense of morality and relationship to society when working in our current healthcare system. This term, moral injury, was identified by Talbot and Dean in their article entitled "Physicians Aren't Burning Out, They're Suffering from Moral Injury" in Stat News, July 26, 2018. This has relevance for nurses working in healthcare. Moral injury is being unable to provide high-quality care and healing in the context of healthcare. It is failing to consistently meet patients' needs and has a profound impact on physician well-being and now nursing well-being, and this is the crux of consequent moral injury. And also, routine, incessant betrayals of patient care and trust are examples of death by 1,000 cuts, and any of them may, delivered alone, might heal, but repeated on a daily basis, they coalesce into the moral injury of care. So what are the causes of moral injury in nursing practice? And we can say that it is the inability to provide high-quality care and incessant betrayals of patient and care and trust that nurses feel. Short staffing is unscheduled absences of registered nurses on a shift-by-shift basis, including day shifts, night shifts, weekend and holiday shifts. So the causes of unscheduled RN absences include, but they're not limited to, chronic fatigue, personal injury, personal illnesses, car or transportation issues, aging parents, child or spouse illnesses, pet illnesses, inability to find childcare, feeling the need to be home with school-age children to help them navigate the abundant number of online courses in schools today, working a second job to make ends meet in inclement weather, fear of making critical clinical mistakes resulting in loss of jobs or loss of licenses to practice nursing, lack of timely support of nursing and hospital administrators to add more staffing on shifts on critical nursing units, or implementing crisis pay structures to incentivize nurses to work more overtime, having to work overtime when nurses fail to show up for work, inadequate personal protective equipment to take care of patients in isolation, and working with COVID patients, failing to constantly provide quality nursing care to patients and families who are afraid, and feeling inadequate to provide safe nursing care for high acuity patients and high numbers of patients, and feeling like these ratios are unsafe. Why should we unionize? Why? What are the chronic issues with moral injury from short staffing and not being heard, which results in nurses choosing to unionize? So unions provide a third-party voice to hear the complaints and stories of nurses who feel they've been neglected, and gives them a voice at the table for safe staffing, lower nurse-patient ratios, and accommodations for patients with high acuity. Also gives nurses nurses have a long-standing trend of feeling like they are not supported for high patient ratios, inadequate staffing, or not enough staff, and not being able to provide the care and support we are trained to deliver for patients and families. And causes of chronic nursing moral injury are not being addressed. So why unionize? In summary, there are deep soul wounds from failing to meet patients' needs, and these cause routine, incessant betrayals of patient care and trust. So I have been a nurse for greater than 40 years. I have worked as a nurse at the bedside for multiple years, followed by multiple years in nursing administration and healthcare administration, and it's imperative that we continue to show support and nurturance for our nursing staff, for the ability of administrations and caring to occur at the bedside by providing adequate staff. If our hospital staff are not supported, or hospice staff or nursing home staff are not supported to provide nurses safe staffing to take care of patients and families, then a third-party issue of contracting with the union is a potential answer. It is my pleasure to speak with you today. I am Karen Sanders. If you would like to call me or contact me, you can reach me by calling 828-778-8882, or you can also email me at karen@rnpatientadvocacy.com, karen@rnpatientadvocacy.com. Thank you very much.